let's start with Dr. Philippa on this one. So 6 times more likely to be obese if your parents were obese at the same age that you are, kind of general middle age. So does this mean that we now know whether it's nature or nurture?
The answer to the nature versus nurture debate is always a little bit of both. But when it comes to obesity, this study actually tells us something new. What we knew before was that if you had parents who have obesity, that you were more likely to become obese yourself. But we hadn't tracked the impact of that after childhood, once you left home and your environment changed. So that's the nature bit. And now we know that that tracks all the way into middle age. 6 times more likely if both parents have obesity, 3 times more likely if one parent has obesity. And actually, this gives a lot more weight to what we've talked about often on this show, which is that most of obesity is related to your genes, and that there are hundreds and hundreds of genes related to obesity. But whether or not you express those genes is down to your environment. So essentially, your genetics loads the gun and your environment pulls the trigger. And what's really important there is that if those genes are expressed before puberty, you are likely to experience issues and difficulties with your weight throughout life. And so actually what this shows is that we really, really need to focus our efforts onto preventing childhood obesity, because that's going to be a problem that is going to follow.
So do we assume that the children of obese parents then go on to eat in a way or overeat in a way that their parents must have done to become obese? So you learn habits as a child, and some families tend to drink a great deal of alcohol, some families go for general runs as a family and come back and eat an entire lettuce leaf and 1 tomato, and other families go for feasting and eating and talking over meals, and the food thing is a huge thing. And is that what's happening? You learn that as a child, and then as you become middle-aged yourself, you emulate the environment in which you grew up. So you're eating a lot because your parents used to eat a lot.
That's only part of it. Yes, that's part of it, and a really important part of it. And when we actually talk about childhood obesity, often we talk about changing things for the entire family. So yes, it's part of it. But those genes involved are genes to do with how hungry you feel and how full up you feel. And we know that people who have obesity feel hungrier, they feel less full when they eat, they are more likely to eat quickly. It can affect the kinds of foods you eat, the kind of people, the genes that literally affect whether or not you can walk past the bakery or have to go into the bakery. So it's a combination of those things. So yes, genes are important and environment is important. And what I don't want is people to say, well, if it's just my genes, there's nothing I can do. But I think that we need to be honest about how difficult it is once you have obesity to lose that weight. But that doesn't mean that eating healthily and physical activity aren't beneficial. Of course, they're beneficial, irrespective of your weight and your size. But it will be a combination of both genetics and environment, and that's going to follow you.
Let's bring Duane into this conversation. Duane, how often do you have clients or patients who say, look, Duane, look at me, I'm extremely overweight, but of course my mum was overweight, my dad was overweight, my grandparents were all podgy, and so really there's not a great deal I can do. We're just a fat family and that's what we look like. If you do have patients like that, how do you deal with it?
Well, you shift the dial from looking at the weight as the issue, because quite often we look at society-wise as an aesthetic issue, and focus on health. And there's a lot you can do to improve health. As Philippa was saying very clearly, it's not all about what it says on the scales. You can change the diet, you can improve health. And yeah, the genetic aspect is true. And there's sort of 50% is probably linked to genetics, but also we know society has an effect. It's an environmental factor as well as psychological aspects. People living under hardship, children living under hardship, are more likely to eat quicker. They're more likely to take that quick reward. So we have a whole complex things that lead to the weight gain and the food choice. But by making healthier food choices, by being more physically active, you can improve your health. independent of your weight changing, but generally, if you do improve the diet, improve the physical activity, people's weight does come down. So instead of focusing on the weight as a primary outcome, focus on the health as a primary outcome.
Dr. Philippa, why is it that we are so badly losing the battle of the bulge? And you know, I've been broadcasting for about 30 years or something, even longer, and you know, it never gets better. It's never like, right, great, we've had this fabulous campaign of public education, the 5 a day or the Daily Mile or whatever it is, and look, it's really working. It never does work. Why is that?
Because it's complicated and complex, and society is complicated and complex. And if it was as easy as take this pill, do this one thing, we would have absolutely done it. And some of the reason why it's so complicated and complex is due to the stigma around having obesity. We know, for example, that if you have obesity, you're less likely to get a front-facing job. You're less likely to be a receptionist, or in the hospitality industry, you're less likely to be employed. You're less likely to go to your doctor's appointments. You're less likely to attend screening. And that stigma and shame around it feeds into both the physical and the psychological health issues that come with obesity. And so actually, I think that until society changes, until society accepts that obesity is a chronic relapsing condition, that it is a chronic disease that we need to talk about and shift the move away solely from the person who has the condition, until that happens, then actually we've still got a really long way to go.
All right, where is Wegovy, or whatever other trademark names it has? So I'm talking about the weight loss jab, which I hear more and more people using. And I hear that you can even, for example, get it through Boots the chemist. You fill in various forms, you get asked various questions by various doctors online, I think, and you can be prescribed this weight losing injection. And I hear that lots of people are finding it a great success. What role does that play?
So these kind of weight loss medications, there's a daily one, there's a weekly one, there are others which are actually coming forward, have a definite role to play, and they are effective, and the evidence base around them is really good. Now, what you're talking about going online to a pharmacy, that's about a private prescription. And actually, we know that obesity is definitely related to socioeconomic status as well. And so through a pharmacy, it's only available privately, and it's expensive. And in my local area, the NHS wait to be seen in obesity clinic and bariatric clinic is years. And you know, we're referring, and there's an awful long way to go there. There are evidence-based treatments for obesity. Surgery is effective, and these medications are effective, in combination with diet and psychological treatment as well. And there are talks about how early we should be using these treatments, and potential, not surgery, but medication, potentially using it in younger and younger people, because as always, prevention here is better than cure. So there's definitely a role for them, but there is also a real role around education. We don't teach home economics so much anymore. We don't teach things like that. There's definitely a role for government to be involved with, for example, town planning and food deserts, and your ability to reach cheap, affordable food. And so there's an awful lot of factors involved.
Thank you very much, both of you. Thank you.